Diarrhea is defined as an increase in the frequency and looseness of stools compared to one's normal bowel pattern. During a diarrhea, the overall weight and volume of the stool is increased and the water content is increased to about 60 to 90%. Osmotic diarrhea occurs when a non-absorbable solute pulls excess water into the intestinal tract. Osmotic diarrhea ceases when the patient converts to a fasting state. Ingestion of large meals or certain osmotic substances, for example sorbitol or glycerin, can lead to diarrhea. Secretory diarrhea occurs when the intestinal wall is damaged, resulting in an increased secretion rather than absorption of electrolytes into the intestinal tract. Common sources include bacterial endotoxins such as E. coli, Vibrio cholerae, Shigella and Staphylococcus aureus, bacterial infections such as Shigella and Salmonella, viral infections, for example the rotavirus and Norwalk virus, and protozoal infections such as Giardia lamblia and Entamoeba histolytica. Protozoa such as Giardia lamblia, Entamoeba histolytica and Cryptosporidum cause explosive, foul-smelling, large-volume watery stools. This is thought to be caused by invasion of the small intestine, which causes damage to the microvilli and therefore decreases the absorption of fluids. This type of diarrhea can result in large fluid losses and patients are at risk for dehydration. Pharmacologic choices. Acute infectious diarrhea. Oral rehydration therapy is used to prevent dehydration and electrolyte loss in both acute and chronic diarrhea. Oral rehydration solutions should have a balanced sodium to glucose ratio. Excess glucose or excess sodium may aggravate diarrhea as a consequence of their osmotic effect. Here again, the early use of oral rehydration therapy is essential for young children and the elderly. The available opioids such as codeine, diphenoxylate and loperamide are very effective for symptomatic use in both acute and chronic diarrhea. However, side effects limit their acute use and tolerance usually occurs with chronic use. It is important to note here that antimotility effects are not desired if the diarrhea is caused by microorganisms, because gastrointestinal stasis may enhance their invasion. Loperamide has the lowest incidence of side effects and abuse potential. It is available without prescription and is effective in patients with radiotherapy and chemotherapy-induced diarrhea and in patients with ileorectal pouch incontinence. Combining loperamide with simethicone provides faster and more complete relief of acute diarrhea associated with gas-related abdominal discomfort. Probiotics. Probiotics are non-pathogenic microorganisms that when present in the gut improve intestinal microbial balance. Multiple clinical trials have looked at the use of probiotics in the prevention and treatment of gastrointestinal infections in both adults and children.